It's a journey that almost every woman is going to embark on. Why do I say almost every woman? Almost every woman, because some people might not get to the stage where they are in their reproductive ages and are capable of bearing children. Unfortunately, some may have to go back to their maker before it is time for that. Others may also get there, but decide for one reason or the other that they want to withhold this journey until much later in their lives. But generally speaking, when we talk about the fertility journey, we are looking at four main stages. So there is the first stage, which is known as the preconception, before conception, before you get pregnant. Okay. And this period varies for different women because, like I said, usually by the time you start having your menses, which is on average about 11 years old in Ghana, you are considered fertile. You are considered able to bear children. Okay. But some people may not have their first pregnancy till much later in their lives, till their late 20s or 30s, or even 40s these days. So this preconception period varies and it differs from woman to woman. Then there's the antenatal period, okay, which is the period during which you are actually pregnant. And roughly speaking, this would be about 40 weeks. Then there's the intrapartum period. That is the period from when you go into labor till you deliver. For those who would have to deliver by a cesarean section, that is those who will have to undergo surgery. This period is the period from when you are sent to the theater and then your baby comes out. All right. And then there is the postpartum period. So right from when the baby has come out till about 6 weeks, that is considered the postpartum period. And the thing is that each of these stages is very important. No stage is more important than the other. In the past, however, maybe about 30 years or so ago, we used to emphasize more on the antenatal, the intrapartum, and then the postpartum period. But much thought wasn't given to the preconception period until medics realized that if we want to improve our chances of having successful deliveries or having healthy mothers and babies, then we need to focus also on the period before which the woman actually becomes pregnant. Because there are certain things in that period that, if not well attended to, will definitely affect the outcome of the pregnancy and the delivery, and even after the delivery as well. So you will realize in our 30-day healthy lifestyle challenge that a lot of the focus in my personal plan is centered on preconception. So for those who are already pregnant and are in the meeting, please bear with us. We know you've already crossed this stage, but we need to dwell on that stage as well. Another thing I would also like to emphasize before we continue is that when we talk about wellness, it is not just your physical well-being. We are also very, very concerned about how are you doing mentally? How are you doing emotionally? How are you doing spiritually if you are a person of faith? How are you doing financially? Do you have good finances ready to cater for a newborn who has come into your life? Okay. How are you doing socially? Do you have the right social support? Or you don't have anybody you can rely on when you are pregnant and then when you deliver? So our wellness plan encompasses all these aspects of our well-being. So this takes us to day one of our lifestyle challenge. I'm sure we are still together. All right. So on day one, this is what I'd like us to do. You would first buy a diary, okay? And you will label it My Fertility Journey. I'm trying to make this as informal and as fun and as simple and practicable as possible. So on day one, you are going to buy a diary, and on the diary, you write your name and you write My Fertility Journey. This doesn't mean you're already pregnant. It's just a book or a diary you have because you have the intention of getting pregnant, okay? And if you're already pregnant, you can buy this book as well. So what do you do on day one? Ask yourself, what are my fertility wishes? Do I even want to have children in the first place? Believe it or not, there are women who sincerely don't want to have children. They don't want to have their own biological children. So they would rather assist other people in taking care of theirs, or they would rather adopt, or they would rather, help orphans, but they may not want to have their own biological children. But if you do want to have your own, ask yourself, how many do I want? 2, 3, 10? There are women who say, oh, me mama will 14, me I say I'm major 2 into me and Drew baby. And then they keep going till they get to the 14 or near the 14. So how many do you want? That's number one. Number two, what is the spacing? Is it that I want the children to be maybe 2 years apart? So if my firstborn is, say, 6 years old, I'm hoping my firstborn will be 4, my thirdborn will be 2, assuming you want 3 children. That is the spacing. Or you want them to be about 3 years apart, or that between the first and the second should be maybe 4 years. Between the second and the third should be maybe 3 years. And then between the third and the fourth, maybe should be another 3 years. That is your own plan, because you are also considering other things that you are doing in your life. Maybe you are in school, or maybe you are doing a course, or you are on a project or something like that. So you factor all that in. The other thing is, what is the timing? So looking at your plan for your life. So now we are in 2025. You may say, I'm hoping to deliver at the end of 2025. I'm hoping that my next delivery will be in maybe 2029. And then the third one will be in maybe 2032, perhaps. So all that is part of your plan. Now, if you do not want to have children in the meantime, what are you doing to prevent yourself from getting pregnant? Are you practicing abstinence? Are you practicing some safe sex? Are you on some form of contraception? So these are the things I would like you to do on day 1. Then we can proceed to day 2. On day 2, you are still taking stock of your own life, okay? So I wrote down that you would do you'll take what we call your medical history. What does this mean? It means that you want to assess your own self as far as your health is concerned and know what your history is like. So, for instance, do you have any medical conditions like sickle cell? Do you have diabetes? Do you have hypertension? Are there any people in your family with similar histories of these medical conditions? If there are, it means that you are, generally speaking, at a slightly increased risk of having the same medical conditions. Have you had previous surgeries before? If yes, what surgeries have you had? Maybe it was a cesarean section. Maybe you had a fibroid and the fibroid had to be removed. Maybe the surgery you had wasn't even related to anything gynecological. Maybe you had a surgery on your eye, or you had a surgery on your leg, something like that. But at least you've taken stock of that history. Then, if you've been pregnant before, how was it like for you? How was the delivery like? And then after the delivery too, what was the period like for you? Are you on any routine medications? For instance, for some people, because they are, let's say, hypertensive, they are on certain antihypertensives. They are on certain medications to bring down their blood pressure. So you need to note those medications. For other people, they may be diabetic, so they are on certain medications to help control their blood sugar. So that also needs to be taken note of. Some people may be on some herbal medications for one reason or the other. Whatever that means. That is another thing that you need to note. And then, are you allergic to any medications or allergic to any foods? If you don't know, you may want to take your time and go through your history to see if there has been a time that you were exposed to something that you didn't react well to. And then social history. Do you smoke? Do you take alcohol? Or are you smoking? Are you currently taking alcohol? Have you smoked in the past? Did you used to take alcohol? All these things have some effect on how your fertility journey will be like. So once you have taken this history, you take a diary and write the same diary that you are using and write all these things down inside the book. Some of the information you might not have, for instance, if there's any family history, if there's anybody in your family who has a particular medical condition, right? So you may want to ask maybe your mother or your father, an auntie, an uncle, somebody. Then just to make sure that you know exactly what you are dealing with, I have put down a list of labs that I think that every woman in their reproductive age, so any woman who is able to get pregnant should at least know her status when it comes to these things. Your full blood count should at least let you know what your hemoglobin level is like. And your friend with HB, level, then your blood group, which is very, very important. Your sickling status. Are you a sickle cell patient or not? Are you a carrier of sickle cell or not? And if you have a positive sickling status, what is your genotype? And on our HB electrophoresis now, a betrayal, okay? And then G6PD, hepatitis B and C, HIV, and basically any lab test that helps to screen you for diabetes. So these basic things should be done on day 2. The last thing on day 2 I suggest you do is at least check your blood pressure. Okay, check your blood pressure. I must say that for this plan that I have come up with, it is not cast in stone that it was a way and say that it has to be done this way. But I've just developed a simple plan that will take you from a day that you decide to start this 30-day plan. So on day 1, we've already said what you do. And on day 2, we've also just discussed it. So let's move on to day 3. On day 3, another thing you need to assess yourself is your nutritional state. Are you well nourished? And I say, oh, you're malnourished. And I say, you need to do something about your general nutritional state. There is something that we call the body mass index, okay, BMI. Maybe you've heard it before. And this is one of the activities that I would like you to do on day 3. How do you calculate your BMI? Go and stand on a scale, okay? Scale, and check your weight. Usually your weight will be given to you in kilograms. So you write it down. Then you measure your height. Height can generally be measured in different ways, but measure your height in meters. It will be or be checking a height, no, maybe at 1.5 meters. Or be checking a height, maybe 1.7 meters. Write that down. If you don't know how to do this, you can go to the hospital and they can do it for you. So you check your weight in kilograms and check your height in meters. Then what do you do next? If, for instance, your height is 1.5, multiply the 1.5 by 1.5. So multiply the 1.5 by that same figure. Whatever you got for your height, multiply that figure by that same figure and write it down. Then the last thing is divide your weight by that figure that you have gotten. So your weight, which is in kilograms, let's say your weight is 60 kilograms, and then you got a height of 1.5. So 1.5 times 1.5, whatever you got, you write it down. So now your BMI is equal to 60 divided by that figure you got when you multiplied your height by itself. Whatever you get, write it down. The figure you get will decide whether, or will help you know whether you are underweight, you are within a normal weight, you are overweight, or you are obese. So depending on the category that you fall into, you will know that I need to start working on my diet. I need to start working on some exercises so that I do not get into a range which is not normal for me. I must state, however, that the normal BMI is between 18 to 24.9. Anything less than 18, you are underweight. If you are more than 24.9, you are either overweight or obese. So once you get to 30 and above, you are considered to be in the obese range, okay? So on day 3, that is one of the major things we do. And then there's prenatal vitamins. So Vivagest, which is the organization organizing this program for us, has already introduced their products to us, and we are encouraged to make use of it so that it helps beef up our nutritional state. Also, I would like you to make a list of some foods that you usually eat for breakfast for lunch, supper, and then your snacks. Then breakfast, so go ahead, did kinky, and fish, kinky. What should the past 1 week? Kinky, breakfast, lunch, fufu, supper, kele willy, 1 day, be watch it. And then snacks, a come dinner, oh, it's meatball fruits back home, and I saw top fine yogurts back home. When your pizza back home, so and also in your bag. So you just get all that put down. And then you yourself know that you need to have a balanced diet. So looking at the example I just stated, eating kinky in the morning, fufu in the afternoon, and kelewele or watching in the evening is quite unhealthy. So this needs to be adjusted. I suggest that you highlight all the supposedly bad foods in red, and then the good foods, which are more of vegetables, fruits, and the foods that have some soups, a little bit of stew, some carbohydrates and proteins, vitamins, everything together. You highlight those ones in green. So what it means is that you want to eat more of the green foods and less of the red foods. And then on day 3, I challenge you to eat a fruit that day. Okay, it can be any fruit of your choice. All right, there are also some foods that we encourage that you avoid, especially if you have certain medical conditions like PCOS, polycystic ovarian syndrome, which we will talk about next week, God willing. So basically, foods that are very high in carbohydrates or sweet, highly processed foods like Coke, Fanta, pizza, shawarma, meat pie, donuts, all those things, you cut down on them. That is day 3. Then this takes us to day 4. The same way you made a list of foods you take on the regular, I'd like you to make a list of routine medications that you take, including the herbal ones, if any, as well as any allergies that you may have. Then there are certain medications that you should absolutely avoid when you are pregnant. You may not know that you are supposed to avoid them. And that is why if you plan on becoming pregnant, it is advisable to visit an obstetrician or gynecologist who will take all the relevant histories and guide you as to which foods and which medications to stay away from and which ones to take even more. All right. Then on that same day 4, I challenge you to buy a prenatal vitamin. So Vivagest is a good example. And I like to do what I call the brush and take approach. What does it mean? Most of these prenatal vitamins don't need you to have eaten before you take them. So I recommend that you put your prenatal vitamin in front of your dressing mirror or where your toothbrush is. So as soon as you finish brushing your teeth in the morning, as you are putting down your toothbrush, the next thing is what? Take the vitamin. That is what I call the brush and take approach, so that you don't forget. If you can't get the full prenatal vitamin, the one that contains a lot of them, multivitamins, then just folic acid, plain folic acid is good enough. All right, so this takes us to day 5. If I'm moving too fast, please stop me. If I'm moving too slowly, to kindly prompt me. Day 5, we want to deal with stress management. Like I said, we are going on a journey, and we are talking about a healthy lifestyle challenge. So anything that is unhealthy, we need to avoid, and that includes stress. So on day 5, once again, take your diary, write down any identifiable stresses on one side and stress relievers on the other. Into your when you say na babo, man stress, and they say nejuma oye. The person works for, let's say, 12 hours plus, comes home to cook for the children or cook for the family, and then in the morning has to wake up very early and is back on the road. And see, all these are stressful factors for the person. There are certain meetings that you have to attend maybe 4 or 5 times a week. It is stressful for you. Write them down. Then the stress relievers are things that you do that help you feel relaxed. So for somebody, it's maybe listening to music. For somebody, maybe going on a walk. For someone, it may be going to church. For someone, it's maybe, just chatting with a friend. So you make a list of that too on the other side. Then just match up one stressor with a reliever. So for instance, if today I come back home after 9 p.m., I know that I'm really stressed. What can I do to help relieve my stress? Maybe I will want to take a shower that lasts for maybe 15 minutes, okay? Or I want to buy a new soap and try it. It will help me calm down. Or maybe I want to listen to music for 10 minutes before I sleep. Whatever works for you is fine. So it helps you to manage your stress levels and it helps you to prevent stress. There are some stresses that are positive. For instance, going to work. One page, man, because so I'm not saying don't go to work, but when you go to work, how are you making use of your time so that you don't become overly burdened by the work you have to do and come back home even more tired? So these are some of the tactics that we can take. And also on day 5, please drink at least 3 liters of water, okay, so that you stay hydrated. So these are some of the activities we can embark on to help us in our wellness plan. To day 6, now it's time to study your menstrual cycle. This is a very important aspect of our wellness plan. For some women, their menses is not regular. Others, it might be regular. So when I talk about regular menstrual cycle, I'm talking about a cycle that is between 26 to 32 days and the regular. So for some, maybe this month it came after 26 days. For some, it may have come the next month, maybe it comes after 28 days. Maybe the next month it comes after 27 days. But as long as it's within the 26 to 32 window, it is relatively regular. But so be 26 days today. The next month it will come, let's say 33 days later. The next month it will come 42 days later. The next month, 21 days. That is a pretty irregular cycle. So you have to study it very well. And then note the number of days you bleed for. And when you bleed, is the bleeding so heavy? Are there so many clots? Do you experience a lot of pain? Just take note of all these things because they will help you know what conversations to have with your gynecologist when you visit him or her. And then on day 6, I would also like you to quickly walk to your wardrobe or wherever you keep your sanitary pads or your panty liners or your tampons, whatever you use for your menses, and check, do you have enough available? Okay, this is all part of making sure that you are healthy, you are well. And if possible, download a Flow app. There are quite a number of them online. Any of them is reliable, is good enough, and then you can use that to help you track your menses. Then day 7, the knowledge you gain from studying your menstrual cycle will help you to know which days you are fertile. That is the days that you are likely to get pregnant and the days that you are unlikely to get pregnant. So if you are somebody who is trying to get pregnant, you engage in more sexual activity during that unsafe or your fertile period. And if you are trying to avoid pregnancy, you also abstain from sex or use some form of contraception during that unsafe period, okay? Then there are some signs that will let you know that I'm ovulating or I'm releasing an egg now. What are some of those signs? Usually you may notice that if your menses is pretty regular, usually it is in the middle of your cycle. So if, for instance, you have a 28-day cycle, typically it may be on day 14. That is 28 divided by 2. But I cannot look at your face and say that, oh, it's day 14, so by all means, you are ovulating. You may have ovulated a day or two earlier, or you might ovulate a day or two later. So you need to give yourself a range. So anytime from when your menses ends to about day 16, for somebody with a 28-day cycle, you are most likely fertile. So that is the period you are encouraged to have more sexual activity. If your cycle is irregular, there's a different way of tackling it, but I will address that only if that is of concern to someone in the question session. So I'll continue. Other signs of ovulation include when you check your temperature and realize that you're a bit warm to touch. Your temperature is like your body is a bit hotter than usual, okay, after your menses has ended. Sometimes you notice that your breasts are much heavier than usual. Sometimes you notice that the discharge that comes from our vagina, which is normal for every woman, has increased in volume. So the amount is a bit more than usual. And it's also a bit more stretchy. It's looking like the egg white when it is unboiled. When you haven't boiled the egg, the white part of it, okay, it's looking like that and it's stretchy like that. So all these are signs of ovulation. There are also ovulation test kits in pharmacies and other shops that you can buy That will help you check to see if you are ovulating or not. So on day 7, I'd like you to assess yourself to identify which stage of the cycle you are in. Please remember that you can start this 30-day challenge on any day of your choice. So day 1 is when you started. Day 7 is the 7th day after you started. And on that day, the activity I'd like you to embark on or to engage in is to assess which stage of the cycle you are in and possibly buy an ovulation test kit if you want. All right. So on day 8, we change the focus now to your partner. Remember that pregnancy is a two-way street. It is not entirely dependent on the woman. The men also have a huge role to play. So the same way you took stock of your medical history, whether you have some conditions like sickle cell or diabetes or hypertension or whatever it might be, you need to do the same for your partner, okay? And this, especially for alcohol intake, which we know, generally speaking, because I know that is not entirely the case, are men generally taking a bit more alcohol than the women, okay? So the alcohol intake alone has a profound effect on the quality of semen or the quality of sperm, and smoking as well, in addition to certain illicit drugs that are on the market people use, for various reasons, like weed and cocaine and all that. So you want to assess your partner's health in such a manner so that you know just how well your partner is. If possible, have a conversation with your partner and then the same labs that you did, I'll encourage that your
Hello, Doc. Can you please unmute yourself, please? Hello?
Hello.
Yeah, sorry.
Was I
Yes, sorry.
unmuted this whole time?
No. I think for about 2 minutes ago. Sorry.
Oh, okay.
There was some technical issue. Sorry.
That's okay. Please let me reshare my slides because I had to stop sharing at a point. Please let me know when you can see them again.
Yeah, I can see them. Yeah.
Okay, thank you. So I was talking about sexual activity on day 9 and the fact that pregnancy can be achieved either naturally or artificially when you engage in when there are other challenges or barriers to having pregnancy through the natural route. Okay. So I was talking about adequate sex as well. And I was saying that adequate sex is when you have penetrative, ejaculatory sexual intercourse, okay, at least 3 times a week. What I mean is that, number 1, there must be some deposition of sperm inside the woman's vagina. And why am I stressing on the 3 times a week at least? The reason is that the woman, when you ovulate or when you release your egg, you have a maximum of just 24 hours or 1 day for that egg to be fertilized, for that egg to meet a sperm, and for you to possibly get pregnant. Once that 24-hour period goes by, you will have to wait for the next month to try again. But for the man, once the sperm is deposited, it can stay there for even up to 5 days. It's been shown that it is more potent or it is stronger in the first 2 days. So once every other day there is sexual activity, it means that every other day, we have a fresh deposit of sperm, okay? And most likely, pregnancy would be achieved, all things being equal. So you need to note how you guys are going about a sexual activity. A woman, and I say, we are actually serious about it. And the other thing too is that you shouldn't put undue pressure on yourself that because I want to get pregnant, hey, today we must have sex, so hey, tomorrow we must have sex. So when you put that kind of pressure on yourself, your body realizes that you are under pressure, and it's rather secrete certain chemicals that do not help you achieve pregnancy. So try and make it as fun as possible. So what is our activity for day 9? There are some foods that can boost libido. And sexual drive, generally, is a bit lower than the average person. So there are certain foods that have been shown to increase your drive or whet your appetite, for sex, including watermelon, dark chocolate, okay, avocado, and pear. Then there are some fruits we call dates, and then any nuts, as well as sardines and salmon. These have been shown to increase libido. Then go and check your list of stress relievers. Perform any of them that day. Shopping now, you're relieved from stress. Maybe go on a window shopping. The emphasis is on window shopping because maybe you may not have planned to shop that day. So don't go and waste money when you don't need to. And then try a new sex position that day with your partner. Okay, that all helps to make the journey a bit more interesting, a bit more pleasant, for both of you. Then we move to day 10. Day 10, let's say now you are pregnant. So what's next? How did you know you were pregnant? First of all, you realize that you probably didn't have your menses that month, okay? And perhaps you took a pregnancy test either at home or you went to the hospital and it was positive. Once that is done, an important thing to do is to take an ultrasound to identify where the pregnancy is, because sometimes you may have the pregnancy not inside the womb, but outside the womb. It may be in the tubes or elsewhere. And any other location of pregnancy apart from inside the womb can be very, very harmful. Now, when it comes to the ultrasounds too, sometimes you would have the probe put over your abdomen, not omega scan. And there are other types that you can put the probe inside the vagina. Usually, those ones are better when the pregnancy is still very, very early because it gives you clearer images, clearer and more information, as compared to the abdomen at that early time in the pregnancy. But once the pregnancy is above anywhere from 7 weeks, 8 weeks and above, the abdominal ultrasound is just as good as well. And then it's ideal that you book a visit to the obstetrician or gynecologist. Now, for our wellness plan for day 10, I suggest that you start exercising. Remember, we've taken time to go through our medical history. We've taken time to identify stress factors and stress relievers. We've taken time to talk about diet. Now, another important thing is exercise. So on day 10, let's do some 30 minutes of brisk walking. And then that day, I'm reminding you to drink at least 3 liters of water once again. All right? Okay. Now to day 11. So now that you've identified that you're already pregnant, the first trimester, like most of us, if not all of us know, is the first 3 months of the pregnancy. So you would have visited the doctor and you would have been given a list of labs to do. The good news is that most of the labs that you will have to do are the same ones that I listed earlier, I think on day 2. So if you have done them, you already know your state, okay? And then you can present those labs. If you've not done them, this would be a good opportunity to do them. And there are others that will be requested as well. There are a whole lot of things that happen in the first trimester because, your body is now adjusting to the pregnancy. And it might be a new experience for you, especially if you're a first-time mother. So you take your time and enjoy that period of the pregnancy. What is our activity for wellness for day 11? Rest is as equally important as diet, as our exercise, as our stress factors which we are trying to avoid. So on day 11, I encourage you to take a 45 minutes nap. Don't say that you are too busy. You have to make that time to take the nap or find a way to rest that day. Essentially, I'm trying to emphasize the fact that you need to rest, okay? And then just a fun activity. Take the diary that you are writing in and make a list of boy and girl names that you like. Remember that for those of us embarking on this journey, we will all be at different stages at different times. So let's say I start this 30-day plan with a friend. That friend might already be pregnant. I may not be pregnant. But on day 11, when it comes to the activities, we are all going to do the same thing. So whether I'm pregnant or not, I have plans of getting pregnant, right? This will be a good time for me to start making a list of some boy names, some girl names I like, just to make your journey more interesting, like I already said. Then day 12, danger signs of pregnancy. So I'm just educating us a bit on what some of them might be, especially in the first trimester. One of the commonest is what we call morning sickness. For those who have experienced it before, you realize that it can be very uncomfortable and you don't want anybody to experience that, right? But it can happen. Other danger signs are when you notice that you are bleeding or you're having any severe abdominal pain or you're febrile, your temperature has gone high, or you're having these headaches that just won't go away. And then there is such a condition known as cervical insufficiency, okay, where sometimes the cervix, which is the closing of the womb, may need some extra support to stay closed so that you don't end up delivering earlier than expected. These can be discussed in detail with your obstetrician gynecologist. But when it comes to our wellness plan or activity, I'm reminding you on day 4, have you taken your prenatal vitamins today? If yes, good. If no, please run and take them. It is not too late. Also on day 12, I'd like you to do at least 100 jump ropes. You don't need to buy the skipping rope before you do it. Just imitate yourself doing some jump ropes, and do 100 of them to help stay active. Then in your diary, who is your emergency contact person when you are pregnant? If you don't know this already, you may want to start thinking about it and write it down. So you're thinking of someone who is very reliable, someone who can easily be reached, and someone who would know what to do more or less when you are pregnant and there is some sort of emergency. Then we move on to day 13. Is it okay to have sex during pregnancy or not? In some conditions, you are told to avoid it. And if your doctor tells you to avoid it, please avoid it until further notice. If not, you may encounter some adverse outcomes that you would not like. But if you've not been given these strict instructions, why not? Sex during pregnancy is actually beneficial for mother, okay, and even for her partner as well. And remember that once mother is okay, most likely baby is also okay, because if it helps to make the woman calm, helps to make her more relaxed, it's just that it may be a bit uncomfortable because now you may have to try new positions because of your expanding abdomen, your expanding belly. But that is okay. It's part of the journey and it helps you to try new things. So what is our activity for day 13? I'd like you to read up on or maybe chat with some friends on their pregnancy and birth experiences. And then you get to know how the journey has been like for some people and maybe how you hope yours would be. Is that okay? Then we move to day 14. So on day 14, we are going to talk about a few second trimester things. So weight gain is one of the things that you would really notice in the second trimester, that you are putting on more than usual, which is okay. But ideally in pregnancy, the acceptable weight gain is between 11 to 16 kilograms. So whatever your weight is before you got pregnant, you are expected to gain about 11 kilograms more, up to about 16 kilograms. Anything more than the 16 is too much. Anything less than the 11, depending, may or may not be too much, okay? And then there are certain dangers of the second trimester too, like high blood pressure, high sugar levels, and all that. So those we can discuss in detail later. But on day 14, I'd like you to pay a mother a visit and assist with taking care of the child. It just helps you to know what you are up for or what you should expect once you have your own. All right. Remember that our wellness plan is not just physical wellness. It is also emotional wellness. It is also mental wellness. That is why some of these activities seem like, now in some day. But if you think about it, they help you to prepare adequately for this journey or help you to be better equipped to handle this journey. So on day 15, at this point, we are halfway through our wellness plan. The third trimester danger signs are also, it also includes bleeding. And then you may see that you may be losing some fluid even before you are in labor, okay? Or losing lipo. That is the fluid around the baby. Ideally, this shouldn't happen until you are in labor or about to go into labor. You may also have some abdominal pain or some persistent headaches or high blood pressures. None of these is acceptable in the third trimester. Okay, so if you notice any of them, please visit your doctor. Now we are back to activities and back to our exercises for our wellness. So on day 15, if you've not done some before, today you do 50 squats and 10 push-ups. And remember to drink at least 3 liters of water today as well, including a 45-minute nap in your day's plan. Don't forget, we are talking about wellness of our bodies. Day 16. Now, let's say you are preparing for delivery. And like I said, preparing for delivery, you have to be ready physically. Have you bought the baby's items? Have you bought your items? Spiritually, if you're a person of faith, how are you doing in your work with God at that point? Emotionally, are you stressed? Are you angry? Are you troubled? Or you are happy, you're expectant? Mentally, where are you? Are there things you need to deal with? Financially, have you gathered enough money? Maybe you've been told that you need to buy a vaccine for your baby when your baby is born, for instance, hepatitis B vaccine, or you need to buy immunoglobulin for your baby when your baby is born. Do you have the money available? Social, do you have people you can rely on to help you in your journey? So these are things that you should think about. In your diary, I would like you to just write on that day, where would you like to attend your antenatal clinic and why? Why are you choosing that facility out of the many in your area or the many you have heard of? And also, who would you want to be with you when you are in the delivery room? Because this is somebody that's perhaps will be very close to you. If you don't want anybody there that is okay. But at least somebody who is close by in case of any emergencies. That takes us to day 17. Let's say it's time for delivery. Now, when it comes to the mode of delivery, it can either be vaginally or by a surgery where we'll perform cesarean section for you. Ideally, the best route for delivery is vaginal because that was the natural path that God created. However, there are some conditions under which the vaginal route will be harmful for either the mother or the baby, or both of them. So in those cases, we advise that the woman has a cesarean section. Nti mepacho wote say obi aye CS and say saa nipa no onye oba anase woye oba say no esan say sebe wo fa wase. No. And then if the person has to undergo the cesarean section, it will be done under a very competent eye or by a very competent team. So that is what we expect for delivery, either vaginal delivery or cesarean section delivery. In your diary, I'd like you to write what is your preferred mode of delivery and why. So you may have a preference. Maybe I may have a vaginal delivery. And then you write your reasons why, okay? But note that when it is actually time for you to deliver, this might change depending on whatever is going on at the time. All right. Day 18. If you're going to have a vaginal delivery, there are certain things you should expect. I mean, while you're in labor, you'll be having what we call contractions. I'm sure most of us have heard about it before. And then our midwives or doctors will be inserting 2 fingers maximum, right, into the vagina to assess whether the opening into your womb is opening up gradually the way it is supposed to so that your baby can come out. Some people say it's uncomfortable or it's painful. It might be uncomfortable, but it shouldn't be painful. Okay, so these are some of the things to expect. You can also eat during labor, but we generally encourage that you have light foods, maybe a cocoa, maybe a what's it called, soup, and maybe a little rice, nothing too heavy, because sometimes the vaginal delivery, which is the expected mode of delivery, might be converted to a CS because maybe there is a complication. And if you are going to have a cesarean section, it is ideal that it is done on an empty stomach. Okay. Then on day 18, I recommend you watching a YouTube video on various birth positions, because most of the time what we see in our hospitals is mame pacho daho na bie winemu. But do you know that you can also squat? Okay. Do you know that you can also kneel down and that your knees will be on the floor and then your hands will also be on the floor? So we call that an all fours position. These are all different bed positions that can be adopted. You see, the one that is comfortable for you is the one that we can adopt in your hospital. So you can watch a video on these and then get acquainted with them. Also, on our diet, I would recommend you eating a bowl of vegetable salad. That salad should have minimal or no ketchup or mayonnaise or any of those additives. Please, as much as possible, limit the amounts on this day while we are on this wellness plan. Okay, so you can be eating this bowl of salad while you are watching the video. Then we go to day 19. Let's talk a bit about the cesarean section. What should you expect? If you will have the cesarean section, it means that the night before, your last meal would typically would be around 8 o'clock p.m. That is if it's a cesarean section that has been planned. But if that's a emergency, yeah, you be yamal. Regardless of the time that you have come. Okay, so that you do not feel any pain while we are having the surgery for you. Then the surgery is done, and then you are sent to the recovery. That is a very simplified way of talking about the cesarean section. But it is also safe if it's done by a competent person, but it also has some risk. Okay, generally speaking, a cesarean section is 4 times riskier than having a vaginal delivery. But when it is clearly indicated, when there is a need to have it done, it can be done and done very well. Because no person, if the person has not been certified to perform a cesarean section, that person is not allowed to or is not supposed to perform that cesarean section for you. Okay, what is our activity for day 19? Reminder, once again, have you taken your prenatal vitamins today? If yes, good job. If no, you know what to do. Then our exercise, 30 minutes brisk walking once again. Now, let me say about the exercises that it can be any exercise of your choice that you are comfortable with. Some people are used, maybe they were sports women or athletes before they even got pregnant. So their bodies are used to doing some forms of intensive physical activity. Do what is okay for you. Don't do what is too much or what is overly strenuous on your body. So if your friend can jog while she's pregnant, it doesn't mean you should also go and jog. Yours can just be brisk walking. Okay. And then I would also encourage that you watch a YouTube video again on cesarean section while you're eating that bowl of fruit salad. So the day before you had the vegetable salad. Today, let's try a fruit salad. So maybe watermelon plus pineapple plus banana plus grapes all put together in one big bowl. I'm sure you will have a great time. Day 20, our baby is here, or maybe not. We all expect that our babies will be delivered healthy, right? But sometimes we end up not going home with our babies. It doesn't mean you have done anything wrong. It just means that it is one of the possible outcomes of pregnancy. And there are ways to deal with it. That is not the focus of our discussion today. So I wouldn't stress too much on that. But all that we are talking about today is towards us going home with our healthy babies and we ourselves also going home in a healthy state. So what activity do I want us to embark on today? Please take time to examine your breast. Why? you may have never done that before. Maybe it has never even crossed your mind. But if you take the time to examine your breast, you may notice that there are some abnormalities that may need to be dealt with. Maybe you find a lump. Maybe you find that your nipples are inverted. Into nipples, instead of say, so those kinds of nipples are not very favorable, or they don't really help when it comes to breastfeeding our babies, right? And there are ways of dealing with them or handling them so that we can easily express breast milk for our babies. So you just take your time and examine your breast on day 20, whether you are pregnant or not. All right. Okay. Day 21. If your baby is not here, there are certain things that can be done. Sometimes we can do an autopsy for you. It helps us to identify most of the time what might have been the most likely cause of that baby's death. Okay. If you don't want that home with the baby and bury the baby or do whatever you want to help you deal with the situation, that is okay. Then you all have to milk, because if the pregnancy was far advanced, anything above 20 weeks, by this time, you've already started producing breast milk. It means that now we need to get that breast milk out so that you don't end up having what we call mastitis or infection of the breast, okay? And if you had a cesarean section, or if you had a cut in the vaginal area for the baby to come out, we also have to help you address how to take care of those wounds so that you don't end up with an infection. And you also need a lot of psychological assistance. So it can be in the form of a psychologist, it can be in the form of a parent or friends or church members, or some people who are just there for you. All these help you to deal with that whole situation. Our activity for day 21. Take your diary once again and write down, what are your fears about pregnancy and delivery? Just think about it and put them down so that these fears can be addressed. Then what myths and misconceptions about pregnancy and or delivery do you know of? ABI say, oh, dear, we CS back up, a chair say, dear, while walking now, I will say we CS. Is that true or not? And then if you meet an educated person or a person who is versed in this area, the person can give you the right answers to the question. So that's for day 21. Day 22, we are gradually getting to the end of our wellness plan. I would like to stress a bit on some danger signs after delivery. Once again, bleeding. As for bleeding, we don't like it at any point at all, bigger and bigger, instead of smaller and smaller. There are possible reasons for that, and these need to be addressed. Are you having any difficulties in breathing? Are you having any swollen legs? Maybe you notice that your legs are swollen and they weren't like that before. Or if they were like that before, they are getting worse now. Have you realized that maybe your body is warm? Do you have a temperature? Or have you noticed that what we call lochia, that is the normal discharge after delivery, does it have a very bad smell? If yes, most likely there's an infection going on and we need to address that. So an activity for day 22, maybe you have never screened for cervical cancer before. There are various tests available, okay? I would encourage you to visit a gynecologist and plan to have one done. Remember, we are talking about wellness plan from preconception to breastfeeding. Okay, day 23, partner involvement in care after delivery. So you didn't get pregnant by yourself, right? You had a partner. It means that after the baby is here, that partner must also be involved somewhat in how to take care of you, how to take care of the baby, how to take care of the home. So I would encourage you to have a conversation with your partner on your expectations of him after the delivery. Okay. The fact that you are telling him your expectations doesn't mean that he can meet all your expectations, but at least it helps you guys to know where you stand. Are there things he cannot do? Are there things he should learn how to do now? Are there things you two shouldn't expect him to do, or certain things you should still be able to do? At least you are all on the same page. Okay. All right. Day 24. breastfeeding versus formula feeding. Now, the natural breast milk God gave to us is what is ideal for our babies. But in certain situations, the women may struggle with getting breast milk. Even if they get it, it might not be enough for the baby. So we have been able to come up with what we call formula feeds, which are very similar in their composition to breast milk. Okay. And we would encourage that the mothers give this to their babies if they are having challenges with breastfeeding. But as much as possible, we encourage that you don't do mixed feeding. That is Oma breast milk kaka, now I'm a formula kaka. But sometimes it may be necessary depending on the situation. Once again, I'm trying not to go into too much detail about it because that is not the main topic for today. Right. So on day 24, our activity is to watch different videos on different positions for breastfeeding. Sometimes you can breastfeed your baby even while lying down, but some women may not know this. So once you watch these videos, you can educate yourself. And a quick reminder once again, have you taken your prenatal vitamins today? Once again, let me stress that watching videos, writing down things in your diary and all that are all making sure that you are in a state of mental wellness, emotional wellness, and even physical wellness to take care of yourself and your baby. So don't think any of them is a waste of time. We are now on day 25. We are almost at the end of our plan. Post-delivery or after delivery, some women may have some mental challenges, okay? We have what we call the postpartum blues, and there's also postpartum depression, and there's also even postpartum psychosis. So there are different degrees of some mental trouble after you have delivered. The least severe amongst the three that I've mentioned is the blues, because typically that one will go away on its own maximum by the end of the week. And it's simply because you are still trying to get adjusted to the whole birth experience, and the fact that you now have a new tone of it may have some underlying tones of more serious conditions that need to be addressed. So these can be taken up with your gynecologist as well. On day 25, please take your diary again and then figure out or try to remember, are there any mental issues or mental trauma that you have to deal with? Maybe you heard that your friend or your neighbor, when she went to deliver maybe a week ago, she went and didn't come back. So you are really traumatized by that whole experience. And because of that, you don't even want to get pregnant at all. Is there a way to deal with it? These are some of the things that I'm trying to address that we deal with on 25. And then for our exercises, let's try 50 wellness states as well. Day 26, contraception. This one there is a whole topic that can take forever and a day to talk about. But it is important that I decide that if I don't want to get pregnant anytime soon, what am I doing to prevent pregnancy? And there are various methods available. And I know there are a whole lot of stories about different types of contraception. But once again, that is a topic for another day. It will be helpful to educate yourself on the different contraceptive methods on day 26 from videos, from midwives. You can talk to people who have experienced a thing or two, one of the methods or other methods, and then just get yourself abreast with the knowledge. And then also remember to drink at least 3 liters of water that day. Day 27, weight management after delivery. Yes, we said that you're expected to gain between 11 to 16 kilograms whilst you are pregnant, right? But once the baby comes out, that's extra weight. Most of it will go away once the baby is out and the placenta and all that are out. But the rest will also have to gradually go out. And then we've realized from research that if you're able to lose at most of your weight during the first 6 months of the first 6 months after delivery, most likely your weight loss journey is it takes you more than 6 months to lose the extra weight that you gain. So as of losing the weight, it's not your main focus, an important aspect of it. Doing exclusive breastfeeding is one major way. Making sure that you are active in the house. You're not just lying there and letting people serve you day in, day out is another way. Check what you are eating, making sure is also samples. None of these when you know why you push ups no sit ups will be okay. Then day 28. Follow-ups after you have delivered at the hospital. Typically, once you have delivered vaginally, your first follow-up is in about a week to 2 weeks. If you've delivered by cesarean section, we must absolutely see you after the first 1 week. But under certain conditions, we the 1 week or later than that, he or she wants you after the delivery. On day 28, please go and check your stock of prenatal Vivagest is present sample. Even if you don't have that one, do you have plain folic acid? If you are running out, please remember to restock so that you don't miss any day. Day 29, there's something I also want to talk about, which is known as gender-based violence. And sometimes women experience these things whilst they are pregnant because they may not be able to perform the activities they used to, for instance, sweeping or cooking or whatever it might be. Before they got pregnant, they were doing it. But once they got pregnant, maybe they were not able to do it very well. And this might irritate their partners. Sometimes too, they are living with partners who are already abusive, and this abuse gets even worse whilst the person is pregnant. Please, none of these is normal. None of these is acceptable. I've had a patient, in fact, patients who wanted to terminate their pregnancies because the reason for terminating pregnancy. Report to the appropriate. That's why we have police station. Then the activity for day 29. Remember that our wellness plan includes financial wellness as well. So I would encourage you to open an account for child support. Okay, the baby might not be here yet, but if every day or every month they decide that I'll put down, even if it's 50 cedis or 100 cedis towards this child, I think it is a good investment and not a waste of your money. Now we are at day 30. Guess what? You've made it through this wellness plan. You have educated yourself. You have assessed yourself nutritionally, checked your weight, checked your height, calculated your BMI. You have assessed your mental state. You have checked to see if you have prenatal vitamins. You have checked to see if you have enough knowledge about pregnancy, about delivery, about the period after delivery, about contraception. You've done so much in this 30-day period, and a huge congratulations is in order. So on this day, you can reward yourself with a 45-minute nap. Maybe you can stretch it to 1 hour, okay? And then that sweet dessert that Dr. Jilac has prevented you from taking in the past 30 days. Maybe it is a slice of cake, maybe a meat pie on day 30. Feel free and have that small amount, so don't go overboard. And take the time to also express your gratitude or say thank you to any health professional who has been of assistance to you on this journey, because it takes a lot of people, it takes a team to make sure that we get to the finish line and get to it safely and soundly. So at this juncture, I'd like to summarize all that I have just said, that the 30-day healthy lifestyle challenge is a challenge that I have personally put together. You can embark on it whether you are pregnant or not. You can start on any day of your choice. And no matter your state, whether you are currently pregnant or not, the activities for that day are to be carried out because they all help you to be prepared for the journey that you are embarking on or that you are already on. And the good news about it too is that you can take this challenge more than once in your life. Okay, so the fact that you start on, let's say, today is 4th January. So the fact that, let's say, you start tomorrow, the 5th of January, and finish by the first week in February, doesn't mean you don't have to do it again for the rest of the life. Feel free to embark on this challenge as many times as you want. I'm sure that this has been a fruitful session. Thank you very much. So I will end here and open the floor for any questions.
All right, thank you very much, Dr. Jilac, for the wonderful presentation. And whilst we wait for questions to be answered, I want to ask a question based upon what you said. Talking about the labs, in terms of duration, when can they not use that lab resource?
Okay, so the good news is that for most of the labs that I presented, your status doesn't change. For instance, your sickle cell status. If you are a sickle cell patient, it never changes. Let me put it that way. So that one remains constant. Your G6PD status, it never changes. Your blood group, it never changes. But other labs like your full blood C, they might change depending on what you have been exposed to. So when you are pregnant, those ones will definitely be re-requested if you have already done them. But your sickle cell status, your blood group, your G6PD status, those ones do not change. So if you've done them already and you have the evidence or the reports, you can just show up with them and you don't need to repeat. Please, I hope that is clear.
Yes, that is clear. Thank you very much.
All right. Any other questions, please, or clarifications? Okay. So I'm in the chat.
Good evening, no.
Okay, good. I'll answer the questions in the chat box when we are done. So go on.
Okay, good evening. I'm
Good evening.
I'm on cervical psychology, and I do feel severe abdominal pains.
I'm sorry, you said you are on again. I didn't hear that.
Cervical psychology.
Okay.
Yes, and I do feel severe abdominal pain at my lower abdomen.
Okay.
So I want to know what could currently be the cause, because I really do feel the pain sometimes when I walk for a distance. But if I'm sitting or lying, I don't feel the pains much.
Okay. So the answer I'm going to give you is it's not cast in stone that is what might be happening to you. The best way to find out would be to visit your doctor and be assessed thoroughly. But there are various reasons why you may be having the abdominal pain. It could be a urinary tract infection that can easily be treated. It may be contractions you are having earlier than you are supposed to. Okay. They may be, maybe if you have some fibroids, the fibroids may also cause pain while you are pregnant. So there are various reasons, and I cannot sit here and just tell you which I would rather advise that you quick lash there, and for any which trying to come out earlier than expected, it would be better for the seclash to be removed before the baby comes out, rather than the baby trying to force its way out while the seclash is still in place. Please, do you understand what I'm saying?
Yes, please.
Thank you. So your activity for day 31 is to book a visit to your doctor. I hope you can do that tomorrow or latest by Monday.
Yes.
All right. Okay, let me take a quick question from the chat box. Someone said, please, concerning the semen, you said sex can be every other day when trying. Does it affect the strength if you do it every day during that period? Okay, so I'm assuming this person would like to know whether perhaps the quantity of sperm produced it reduces if you are having sex every day as compared to every other day. I think we have to mute somebody. Thank you. All right. So, like I said, the semen can be there for 5 days, can stay there for 5 days, and will be fine. But it's been shown to be more potent within the first 2 days. That's the first 48 hours. And that is why if you choose to have sex every day too, that only increases your chances of getting pregnant. Because like I said, you don't even know exactly when you are likely to be ovulating. Okay, you just have an idea that in this period I can be ovulating. So if you have it every day, no, it does not reduce the strength of the sperm, or the volume might be a bit reduced, but that's the volume of the semen. And remember that semen is a combination of sperm plus some necessary fluid that the sperm must be swimming in. So if the volume is reduced, it's most likely that fluid that is a bit only the quantity of the sperm. So please, if you are comfortable with having having sex every single day, that is very okay. It only increases your chances. If you are not comfortable with that, every other day is equally fine. Please, I hope that answers the question. All right. Let me see. Are there any others? Okay, I think that's the only question in the chat box. If there are any others, I'm willing to take them. I think, if I'm not mistaken, we have just about 6 minutes, now 5 minutes to end our meeting. Any clarifications?
Hello, Doc.
Yes, please.
Yes, please. I'm back again. I want to find out that can I take club quinine tonic?
Please, can you take what?
Quinine tonic.
Please, why do you want to take quinine tonic?
I'm just craving for it, and then I just want to take some.
Oh, you can't just want to take, there must be a reason. Okay. So, once again, I don't know your medical history. I don't know whether you are allergic to it or whether it is recommended in your particular situation or not. So I cannot say yes or no. However, we did used to give quinine, and we can still give quinine, okay, in pregnancy to treat malaria. But it's just that in our day and time, most of the time, we rather do the artemisinin containing medications like artemether, lumefantrine, and. So, please, I can't put myself in a tight position and say yes and no. Please, once again, have a discussion with your doctor, the one who knows you best. Is that okay? And don't take any medication without knowing why you want to take it. Oh, I just want to take it. Oh, I saw my friend taking it when she was pregnant. Oh, I've heard that it helps. But what exactly does it help with? Okay. And why was that friend taking it? And would it be beneficial for you as an individual? Those are the things that you need to address. All right.
Yes,
Thank you.
please.
There's a
No.
question chat box. Please, is it possible to conceive with endometriosis and cyst, having had laparotomy, that is a surgery, before? The straightforward answer to that question is yes. You can conceive if you've had endometriosis or if you have it. Now, endometriosis simply means that instead of the inner lining of your womb to remain within the inner lining, sometimes you have parts of it outside the womb as well. And it can become a bit more complicated to get pregnant if that is the situation, but it is not impossible. Once again, a fertility specialist would help you navigate the challenges that come with having endometriosis and wanting to get pregnant. So yes, you can get pregnant, you can conceive. All right. Any others, please? Or Benjamin, I'll hand over to you at this point.
There's another question on the platform. He wanted to find out that if you have iron deficiency, sorry, let's see it again.
Didn't get that.
Okay,
And
please, does being iron deficient affect fertility?
Okay, yes, that's a very good question. Being iron deficient, does it affect fertility? Yes, it does. And the reason why it does is because, generally speaking, you need iron so that you can be in a state of wellness, okay? If you are anemic, that is, if you don't have enough blood, that's a layman's way of saying it. If you don't have enough blood, it can make you prone to having some conditions that would impact your fertility journey. That will impact you being able to get pregnant in the first place. Now, once you are even able to get pregnant, it means that you're already starting the pregnancy with a low HB, a low hemoglobin. And that predisposes you to having miscarriages as early as the first trimester, even into the second trimester. Okay, if you are able to carry that pregnancy to, let's say, 9 months, once you are going into labor, you're likely to lose blood. In fact, you will lose blood, whether you're going to labor and deliver vaginally or you have a cesarean section. And because you already started the journey with a low HB, the slightest amount of blood loss makes you much, much weaker or makes you more anemic than you already were. And that can be very, very detrimental to either you or your baby or both. So yes, having iron deficiency affects fertility, right from the preconception period all the way till delivery and even into breastfeeding. All right. Thank you. Benjamin.
Thank you. Yeah, thank you very much. I think it's exactly 5:30. I think today the presentation, much details, and people are asking of the slide. The recorded version will be shared on our various platforms. Those who are not our group, kindly go to the chat and click on the link that I shared, and you can join our WhatsApp group. I'll share the recorded version so that you can listen to it again, especially those who came in very late. So thank you very much, Dr. Jilac. God willing, next week, Doc will be available again for a topic on PCOS. And so the same time, 4 p.m., God willing, through Zoom. We'll be sharing the links to our various platforms, Facebook. We are available on almost all the social media platforms. When you go to Facebook, it's Vivagest Ghana. When you go to LinkedIn, it's Vivagest English. Instagram is Vivagest.English. Then also on YouTube, Vivagest English. So once again, this presentation is brought to you by Vivagest. Vivagest is not a company, it's a supplement for preconception to breastfeeding. A time will come that we'll do a full presentation of Vivagest. As I've been saying, Vivagest is still not in Ghana yet. It's present in over 15 countries. God willing, we are hoping that Vivagest will be in Ghana in this month. Hopefully by close of the month, Vivagest will be available so that people can buy it. So thank you very much. God bless you, Doc, for the wonderful presentation. The presentation has been very detailed, and those who will be enjoying the recorded version really enjoying very much. So thank you. God will meet again next week at 4 p.m. Thank you. God bless you all. Keep safe.
Thank you too. Goodbye.
Bye.